session, fifth session, I think, this evening. And we are taking up from the conditions this evening. I will be talking about laboratory values. Before we start, just a reminder, please keep your mics muted. I'm not sure what is happening to my video. I'm trying to get my video, but it's not coming on. So please. Okay. All right. I hope that you're hearing me. Are you hearing me?
I am.
Yes, ma'am.
Okay. All right.
Yes,
Because
yes,
all right. Thank you. It's saying
yes,
that
we can hear you.
All right. Thank you. Thank you. It says my thing is not responding. Okay. So we have, after this lecture, we have 3 more lectures, and then we're going to be having our test your knowledge, and we will have an evaluation after you have the test, so you can evaluate the program. And those of you that would like to do level 1, you will let us know so that we can do that. Another promotion I have to, oh, I should wait until at the end of the program. Just to remember that we are not here to be practitioners. We're not here to treat. Our job is to teach and to live the lifestyle, help others so that they can be healthy, wealthy, and wise. After all, without a healthy body, we are not able to witness as we would have. I just want to commend those of you that are continuing the program to stick to it. And remember, we are having our health summit the 19th and the 20th of May. It will be held at the Georgetown Seventh-day Adventist Church. Now, that is the location that we're going to have. So I'll just invite all of you to be a part of it. It is a 2-day summit, and lunch will be provided and snacks will be provided. So just come with a good attitude and with your minds and your brain to be reset, and to help with the promotion of mental health, which we know is a problem in our society. Without any further ado, I will now invite the person that is assigned to do the prayer. I'm not sure if she's here because I'm not seeing anything. My is not responding. So is Sister Stubbs here? Okay. If she's not here, I'll just go ahead and pray. Oh, Father and our God, we are so thankful for life. We are thankful that you have taken us thus far. You have provided for us. You have given us education, and you have kept us. We thank you, Lord, for the information that we have heard so far, and that you will help us to share this information, and not only share, that we will live the life so others can see you in us. We ask you, dear Lord, to continue with to help us, Lord, that this proceeding will go well this afternoon, and everything will be done to your name's honor and glory. I ask, Lord, that you hasten the footsteps of those that need to be here, and that they will come and they will benefit from the presentation. Interesting presentation this evening. Have your own sweet way now, we pray. In Jesus' precious name. Amen. Okay, can we have the welcome now? Maybe I should come off of this and come back again. Sister.
Yes, I was unmuted. Good afternoon, everyone from across the Atlantic Caribbean Union, those who are in the North to South Bahamas, Cayman Islands, and across the Turks and Caicos Islands. I welcome you to our 5th session on our Health and Hope Certification Promoters course. And Proverbs 17:22 says that the first part I'm just going to read only. A merry heart doeth good, like medicine. So with that, I wanted to share with you just a few non-medicine tips that will do well for your heart. Number one, laughter. Laughter makes blood flow more freely. Hugs. Hug those who are closest to you because this helps to release oxytocin and remove stress from the body. Look and long on those who you love, your spouse, your children, because when you meet someone that your heart flutters for, it gives your heart a workout. Spend time with those you love because it helps to lower your blood pressure. For those of you who have a spouse or in love or courting, preparing for marriage, write some love letters. It helps to lower your blood pressure. Hold hands. This helps to calm nerves, and you can do it with your children, with your loved ones, with your parents. And lastly, a positive attitude. We can all have that. That helps to lower the risk of heart attacks. So I wish to welcome you again. Welcome. And I shared a tip on free medicine, good health for each and every one of us that we can endorse and that we can practice, whether we have someone or we are alone. So with that, I say welcome, and enjoy the presentation that is in store for you.
Thank you very much, Sister McCartney. She has just been through a series of family life, and I see that she have learned and she is putting this into practice because she's teaching us some of the tips. Yes, I was there. It is now my distinct pleasure to present the facilitator, the teacher, the mother, the presenter this afternoon. I have known Sister Sashoy Duncan for a number of years, and the place that I met her, that we got to be friends, is into a prayer room. Yes, she is a woman of prayer. We used to be co-workers together, and we used to meet at 12 midday on a Friday to pray. And she was one of the few persons that were in that prayer room on Friday because we believe in prayer. Sister Sashoy is a brilliant go-getter, somebody who knows what she wants, somebody who does what she wants. She's not a person that to look and ask what happened. She's a person to make it happen. As a medical technologist, she is a part of the CASMET, which is the Caribbean Association of Medical Technology. She served as president at some time or the other. She was also the medical technologist of the year. She can't say which year it is, but I know she was 1 year. I know she was a Toastmaster. She served as president. She served as area director, and she served as district director. No ordinary woman. Sister Sashoy is married to O'Neill Duncan. If you have not heard him sing, you need to hear him. And between them, they have 3 children, 2 boys and 1 girl. More importantly, with all the acclamation that I'm giving her, she is a woman of God. She loves God. She serves in the church as an elder. She also facilitates Bible studies and make sure that those persons, and the retention, I think that's retention, yeah. Make sure that those new believers know that they are welcome. And something that some of you may want to think too, they have graduation for them too. Yes, Sister Sashoy is poised Sister Judith Robinson, please can take off your mic. Yeah, she is poised and she is ready with this presentation. And I pray that we will have learned something this evening. Without any further ado, I'll introduce you to Mistress, Elder, Medical Technologist, Mother Sashoy Duncan. Over to you, Sister Duncan.
Thank you so much, Nurse Hazel Fletcher. Good evening, everyone.
Good evening.
All right, excellent. Excellent. Now, this evening, we will be talking about laboratory values. But first, let me say special thank you to Nurse Fletcher for that lovely introduction. We give God thanks for his many blessings upon our lives, and we know that it is in him that we live, move, and have our being.
Are you using two instruments?
I am.
Okay, there's a feedback. Echo, yeah.
Okay, one is muted. Are you still hearing that echo?
No, you're good now.
Okay, excellent. All right, laboratory values. Can you see me? You're seeing my screen? Yes, you are. Okay, good. Okay, excellent. All right, let us begin. When we talk about laboratory values, or the laboratory in general, we think about persons who work behind the scenes to bring us some results. We send a sample to a lab and magically results appear. But it takes a whole lot more than magic, and we'll be giving you a peek into what happens in the laboratory this evening. So the pathology laboratory aids in preventative medicine. It aids in diagnosing diseases and also monitoring treatment post-diagnosis. We also have sections such as blood banking that aids in saving lives and improving the health of people. Now, we focus on blood and other body fluids. So we accept blood and other body fluids and we test them to make sure they are disease-free, to make sure that the concentration of various elements are correct. It's not high, it's not low, it's normal. And if it's high or low, you can do something about it. We also ensure that we set up quality systems so that when you receive your results, you know you're receiving reliable, trustworthy results that you can use, that your physician can use for further treatment. Now, the laboratory involves specimen preparation, specimen collection and testing, and reporting and resulting. So there are 3 core areas, and it is essential that in each area we have accuracy, we have precision, we ensure that everything is done properly so that when the results come out, we have very good results. So it's not, the results begins with you, believe it or not. Accurate results begin with you, the patient, you, the person who will be collecting your sample and sending it to the lab or going to the lab to have your blood drawn or your sample collected. So your doctor or a medical person may say to you, fast, right? Fast for 8 to 12 hours before you have your test done. If you're told to fast, please fast. Okay, it's very important, and fast for that required amount of hours. We don't want to over fast because that too can affect the results, or we don't want to under fast because that will also affect the results. But not all tests are fasting tests. There are several other tests that you do not need to fast for. Some of the more common fasting tests are lipid. You might be told, oh, you need to go and do a cholesterol or a lipid panel. You should fast for that. You may also be told that you need to go and do a sugar test or a glucose test. You should fast for that. So those are some of the more common tests that you are normally told to fast for. Then I mentioned other body fluids. So urine is one of the many body fluids that we collect and test. And you may be told, just give us a random urine. If you're told random urine, you go pee in a cup and give it to the lab. However, you may be given specific instruction for what we call a clean catch. That is done when we're testing for bacteria, we're testing for organisms in the urine, and we want to make sure that we do not have any contamination happening in the urine. So you may be told to do a clean catch, meaning you don't want to touch the inside of the container, you don't want to touch the inside of the cover, and you want to make sure the area is clear, it's clean, and then you want to collect that middle portion of the urine. So the first bit and the last bit go straight into the toilet, and you collect just the middle portion. You may also be told to avoid eating certain foods. And one of those tests that you may hear that with is when you're doing, let's say, the occult blood test, you're checking for blood in your stool. You may be told not to eat certain foods that may be red, right? Red, that may affect may affect the reading of the card in giving you a proper result. So whatever you're told to do, we encourage you to follow instructions. All right, now let's talk a little bit about the various tests that you may be familiar with. We're going to talk about some common ones that the doctor may order for you in the laboratory. And this list is not exclusive. Several more can be added to it. Several more common tests can be added to it. CBC, that's a complete blood count. It covers your hemoglobin, your platelets, your white blood cells, your red blood cells. Within the complete blood count, we want to know if your hemoglobin is low or if it's normal. If it's low, especially with women, you may feel weak, you may feel tired easily. And if the hemoglobin is low, normally your iron level is low. So an iron test, iron TIBC, total iron binding capacity, might be the next test that the doctor may order if you present with a low hemoglobin reading. We have also your platelets. Your platelets help with the clotting of your blood. If you get a cut and you find that you're bleeding for an extensive amount of time, it might mean that your platelets are low, or there may be some kind of defect in the clotting mechanism within your body. So you have the platelet count, which is a part of the complete blood count. Then we have some cells, white blood cells and red blood cells. The white blood cells deals with infections in the body. You have different types of white blood cells, your neutrophils, your eosinophils, your basophils, your monocytes. And depending on which of these are elevated, that can give the doctor an indication that, oh, she is having a bacterial infection, or okay, this gentleman is having a viral infection. So based on the neutrophil, for example, if that is elevated, they will say, oh, he's having a bacterial infection. The lymphocytes are elevated, they say, okay, viral infection. Further tests based on what is elevated for white blood cells. And then we have the red blood cells. Low red blood cells alongside hemoglobin may indicate some levels of anemia happening in the body. We also look under the microscope. We examine the shape of the cells to see if they are small, anisocytes, if they're large, macrocytes, if they're microcytes, macrocytes, and how they shape. Are they sickled? Do they have a sickled shape, right? That means the person may be a sickler. So you can actually look under the microscope and identify these sickled cells, and you can say, oh, we need to do a test to see if this person is a sickler. And then that blood test would be a hemoglobin electrophoresis. And that will tell if there's some kind of abnormality in the blood that is leading to sickling or something else. All right. From the complete blood count, we have the comprehensive metabolic panel. Comprehensive metabolic panel includes, these are chemistry tests. So it includes your glucose, it includes your electrolytes, and it includes some other tests, like some portions of the renal panel and portions of the liver panel. So the renal is the kidney, and the liver. So from the comprehensive metabolic panel, you can learn a little bit about your kidney, a little bit about your liver, the electrolytes in your body, if you're drinking enough water, if your salt content is okay within your body. You can learn a lot from the comprehensive metabolic panel. Next up, we have the renal panel, and that's the kidney. It includes your bone, creatinine, and other tests, right? It's not exclusive, right? But this tells your physician if your kidney is working properly, if there's an impairment. There's also a calculation that we do called the glomerular filtration rate. And it shows the rate at which your your kidneys are filtering urine outside of your body. Now, if that rate is very low, it's an indication that you have some kind of kidney damage. Kidneys are impaired, and you need to have further testing done. So the glomerular filtration rate is a calculation based on your age, based on your gender, and based on your creatinine level. The glomerular filtration rate. All right, so you have your renal panel, that's your kidney. So they bring these enzymes together based on the enzymes released by your kidneys or enzymes that are affected by various various organs, and they put them in groups called panels, and they measure, we test, we analyze these various panels. We also have the liver panel. So you have your liver enzymes like your AST, your ALT, GGT, and others. And we test to make sure that these levels are correct. They are normal. And we're going to be going into normal and high and low shortly. We also have the lipid panel, and most of you might be familiar with this, the lipid panel. In the lipid panel, you have the cholesterol, you have your triglycerides, and you have what we call good cholesterol and bad cholesterol. So the HDL, or high density lipoprotein, that's your good cholesterol, and the LDL, low density lipoprotein, that is your bad cholesterol. So we have many more, right? Okay, we have some more here. We have many more tests that common tests that are done in the lab. So those that I mentioned just now, those are more so blood tests, but we have others like your urinalysis, right? The urinalysis checks for your WBC level in your urine, your specific gravity of your urine. It checks for glucose or sugar in your urine and several other things. We have the urinalysis include a dipstick, which covers like your glucose, your specific gravity, your white blood cells, as well as there is a microscopic portion to the urinalysis assessment where we look under the microscope to see what is in your urine. In looking, we can see bacteria moving around in the urine. We can see fungus. We can see like yeast in the urine. We can see the white blood cells. We can see red blood cells in the urine. But should there be red blood cells in your urine if you are a male? And the answer to that question is no, you should not, unless there is some issues going on. And for females, sometimes we may have red blood cells in our urine. Not that we're having a medical issue, but that's just how our cycle is month after month. All right, so we have the urinalysis. We also have the urine culture, and I mentioned earlier about some tests where they're checking for bacteria in your urine and they say you need a clean catch. So the urine culture is one of those tests where they're checking for bacteria in the urine. So you want to make sure that the sample that you submit is a proper sample, one that is not contaminated, so the lab has something proper to work with. We have also several other cultures, stool culture. So in all these specimens, we are checking for bacteria in the various specimens. We have sputum culture, ear culture, nasal culture, you name it, they can culture it, right? So we check for bacteria. And in the microbiology lab, what happens in doing a culture, you send the sample, right? And then they grow the sample, they grow the microorganism. So the sample is placed on a plate, like a plate with food, right? That food is called agar. And then we allow, if there's organism there, they will feed on the agar, they will consume the agar and multiply, get bigger and bigger, and they will be able to not just see the microorganism microscopically, but then they'll be able to see it macroscopically because it will grow, form colonies, and from those colonies, they can identify what organism it is and then move on to determine if it's a pathogen or if it's a normal flora. Pathogen means something that's disease causing, something that can be dangerous to your body, and normal flora mean that it's a bacteria in your body that exists normally in your body. So sometimes we have bacteria in our body, in our mouth and elsewhere in our body, but they are normal and they work to keep the pH balanced within our system, and that's normal. But we have other bacteria that's considered pathogen, that's considered dangerous. If they get in our mouth or get inside our bodies or elsewhere, they will cause stomach pain, they will cause diarrhea, will cause discomfort, and can even lead to death. So we encourage that you ensure that you get tested if something is going on and get your results. Other tests include pap smears for the women. You get your pap smears done. The sample is collected and it's sent to the lab. So that aspect of the laboratory is called cytology. You heard about microbiology earlier. That aspect is cytology. They check the cells and they check to see if the cells are cancerous or precancerous, if it's leading to cancer. So the pap smears is another common test that is done to ensure that we are cancer-free. Since the past 4 years, this last test has become very, very popular, the COVID test. And a lot of persons got more familiar with with laboratory personnel as a result of the COVID test, because they had to put these long swabs up the nose. For many persons, it was very painful. And collect that nasal specimen, and they take it and they test it and they tell you if you have COVID or not. And they can give you a value as well to see how high the organism, the virus is in your system, right? So the COVID test is another very, very popular test that is done within the lab setting to get an actual value. We also know that we have these little swabs that persons can use. You just barely swab the surface, the outer area of your nostril, and you place the sample on a card, and you can get your 2 lines, whether positive or negative, right? That's that's a simple step. But within the lab, it's more technical. It's placed on a machine. All right, and then we have less common tests. We have like biopsies. Sometimes the doctor may suspect or they want to check if there is cancer in some aspect of the body. You may feel a lump in the breast. You may feel a swelling somewhere in your side, in your neck, on your leg. and you're wondering, is this cancerous? They may do a biopsy where they place a needle inside, they pull some of the cells, some of the fluid out, and they send it to the lab for testing. In testing, the lab can analyze the cell, look at the cells, look at them under a microscope, and can determine, yes, this is cancerous, or no, it is not. We also have tissue analysis, where an entire tissue, so they may cut off tissues of different sections of the body, and the entire tissue is analyzed, and this is called histology. So we have cytology, histology, microbiology, blood banking, hematology, chemistry, different sections of the laboratory, but all come together to form the pathology laboratory. All right, so we're still talking about laboratory values. Sometimes you will do a test and it comes back high. Sometimes it comes back low. Sometimes it comes back borderline. Other times it's normal range. And many times working in the laboratory, patients will come and say, hey, can you explain this result to me? And my response is normally, it's best for you to have your physician explain these results, because your physician has the full picture, right? They know your medical history. They know what has been going on with you. And they can use that knowledge along with this result to say if this is something that you need to worry about, or if it is something that you don't need to worry about, right? So high. If the result is high, usually it means that there's some kind of abnormality. But emphasis on usually. For example, what about a beta HCG? A beta HCG test is a test used to see if a lady is pregnant, right? So let's say, for instance, we have Mary, and Mary really wants to get pregnant. And the results comes back as high. The beta HCG level comes back as high. This means she is pregnant. Right? No, for us, so it's not for the lab, it's not the lab's duty to explain, oh, your result is high, it means you're pregnant. It's for the patient to see their physician to get a proper interpretation. Let's say, for instance, Mary does not want to get pregnant, right? And then she's told, oh, you are. Without getting the proper guidance, counseling in that medical setting, she may go do something that she's not supposed to do. So we encourage persons to see their physician. Now, if a result is high, yes, in general, it means that there's something abnormal. If it's low, it could also mean some level of abnormality, or it could mean that it's within the normal range, because it should be within that low range. Then you have borderline. Borderline means it's slightly above normal. Slightly above normal. Not extremely high, but still not in the normal range. Slightly above normal. We consider that to be borderline. And then, of course, you have the normal range. And the normal range varies from test to test, right? And these normal ranges are usually provided for you on your result sheet. Depending on the test that you do, you will have those ranges provided for you, and you should be told, okay, you should see HL beside each result, or nothing at all, which might mean that it is normal. All right. Now, last week I heard a little from our presentation last week. This came up and it fits right in with laboratory values. And we're going to be talking a little bit about, I'm going to be using glucose as an example as we talk about units of measurement. Now, glucose, if you are in the UK, they use millimoles per liter. If you are in the US, and I guess also the Caribbean, for the most part, we use milligrams per deciliters. However, you may have devices, many of us have our little home glucometers that we use that may give you millimoles per liter. Some of these devices, you can toggle between both units. You can change to use the one that is that you prefer to use, but either one is fine once you know how to do the conversion, if you want to put things in perspective. So, for example, a glucose level of 120 milligrams per deciliter. If you're not familiar with the milligrams per deciliter and you want to do the conversion, you can easily divide that big number, 120 by 18. And that will give you the units in millimoles per liter. And let's say your device, you're getting the smaller numbers, you're getting the millimoles per liter, 4 point something, 5 point something, 6 point something. Hopefully you're not getting 9 or 10 point something on those machines, right? Because that would indicate that you're a diabetic or your diabetes is not under control. All right, so if you're getting these numbers and you want to convert it to the bigger number, to the milligrams per deciliter, all you need to do is to multiply by 18 and you will have those units, the equivalent value. So you have various ranges, and also the range will change based on the state you're in. And we're still on glucose. The fasting glucose range, you'll be told the fasting glucose range is different from non-fasting range. So for instance, if you're fasting, we're not expecting you to have a 120, 140, 160 reading. We're expecting you to have a reading of under 100 milligrams per deciliter. And you can do the math to convert that to millimoles per liter. It should be under 100. And then 2 hours after eating, we're expecting your glucose, it will go up. After you eat your meal, the body's digesting the glucose. So your glucose reading will go up 120, 130, 140, 150, 160, maybe, depending on what you ate. But then we're expecting it to come all the way back down after 2 hours to around 120, 130, thereabout, right? It should not stay up. If it stays up in the 140, 150, 160 region, it's saying that, okay, your body is having a problem breaking down the glucose. So this may mean that there is a problem. You're a diabetic or the diabetes is not under control. We also have other tests that they use, and more specific tests that they use to check for diabetes, which is the hemoglobin A1C. Thankfully, you don't have to fast for the hemoglobin A1C because it checks your glucose level over a 3-month period. So no need to fast. They'll collect a sample, they will get that test done, and you will have your results, and you will also see that range, what is considered normal and what is considered high for your hemoglobin A1C. All right. Now, blood banking is one aspect of the laboratory, the pathology laboratory. Blood banking involves donating blood and processing that blood and transfusing it to someone who needs it. In various countries, it's done differently. The way they get their donors, it varies. Sometimes they'll say if you have somebody who is pregnant about to deliver, they must get 2 donors to donate blood for them. Other countries, they'll say whosoever may come, we're not tying anything onto it. We're seeking volunteers to come in and to donate their blood. And once that donation is made, first you're checked to see if you are healthy, if your hemoglobin is at the right level. So you are checked to make sure that all is well. There's a questionnaire that you also answer. Your blood is collected, your blood is tested for various diseases that can be transmitted via the blood. And if all is well, the blood is stored, and we wait until we have someone who is in need of blood. Once we have, let's say, somebody who met in an accident and they're losing blood, they would come in and they would be tested. So we test their blood with the donor's blood to make sure that it's compatible. If it's compatible, that blood, after other preparation is done, is transfused into the patient. You know, there was a time before my time, a long time ago, when how they did blood transfusion, the healthy person would be on one bed, the sick person on the other bed. There's a needle connected from the healthy person, and then there's a tube with the blood flowing through and another needle connected to the vein of the unhealthy person. And the healthy person will be elevated, so the blood will flow out easily. And the sick person would be at a lower level, so the blood will easily enter into that person. No tests, no screens, nothing to check if the person is healthy and also if there's any disease in the blood, right? It's just given directly. But thank God we have come a far way from that, and we actually now test blood. We make sure that it's disease free, and also make sure that it's compatible. And when I talk about compatibility, there are several levels of it. Many persons, you may know about blood type, A, B, O, A, B, O, and then you have O pos, A pos, B pos, O neg, A neg, B neg, and AB neg and AB pos, all of these fancy letters, right? But so you have incompatibility. If I am A and you are O, I cannot give to you. My blood will kill you. But if you are O and I am A, you can give to me, right? So knowing the blood type is important in blood transfusion. And there are other aspects too of the blood that we have to check for compatibility. Now, when I focus on blood banking and the whole transfusion of blood, God comes to mind, because Jesus Christ is our greatest blood donor, because he shed his blood on Calvary that we may have eternal life. So his blood gives us life. His blood gives us hope. And praise God, we have his blood flowing through our bodies. So we don't have to die an eternal death. We can live eternally because of the blood of Christ. Hallelujah. So we have a few Bible verses here. First John 1 verse 7. But if we walk in the light as he is in the light, we have fellowship one with another, and the blood of Jesus Christ, his son, cleanses us from all sin. Matthew 26 verse 28. For this is my blood of the New Testament, which is shed for many for the remission of sins. And Hebrews 9 verse 22. And almost all things are by the law purged with blood, and without the shedding of blood is no remission of sin. And we thank God that is not the blood of goats or rams or sheep, but it's the precious blood of Jesus Christ shed for us that gives us eternal life. Amen. All right, so from blood transfusion, we're going to move a little bit. Another, I guess maybe a hot topic, if I may put it that way, are cancer markers. Now, based on technology, we can check the blood for various what we call tumor markers or cancer tumor markers. So different aspects of the body, different organs in the body, different areas of the body releases certain enzymes, certain hormones, and there are certain chemicals linked to various areas of the body. So if we have elevation in one of these enzymes, then we can say, well, this is something wrong is happening here. So we have various what we call tumor markers. I'm gonna, on screen you have a photo of a human being. Human being is half male, half female, because we want to talk about the various organs on the male side and female side. So we have the breast, and we know, breast cancer, that's one of the more common cancers, and the CEA and the CA15-3. These are tests common tests used to check if there is anything cancerous in the breast. We have the CEA, also used for other things like stomach cancer, pancreatic cancer, kidney, colon, brain, and you see some of these even lung cancer. So it's not specific to a particular organ. But if it comes up positive, that gives the doctor a clear indication that, hey, let's go a bit further to find out which organ is being impacted by this cancer. For our men, we have the prostate. We do our prostate checks. And mute some. Okay, great. For our men, we do our prostate checks to see if you have a prostate cancer, and that is called a PSA, prostate specific antigen. We also have other tests for testicular cancer, your AFP, alpha fetoprotein, and your beta HCG, same beta HCG that we check in women for pregnancy can also be used to check if there's testicular cancer in the male. We have colon cancer, CA19-9, CEA. These are other lab tests that can be done. Kidney, gallbladder, practically every area of the body. Ovaries, your ovaries, the CA125, that's another popular one for our women. Ovarian cancer, we always encourage that we monitor, we get these levels checked, especially if you have family history of any such disease. So we encourage you to know your numbers. We encourage you to check to see what's going on inside your body. We encourage you to do these screens, because a part of laboratory work, we don't want to get the samples when there's already cancer cells there. We don't want to get the samples when there's already high cholesterol or high sugar or whatever the case may be. We rather focus on preventative care. So we rather you do those screens, get tested every year, do your screens, do your workup, so you can know what is happening before it happens. You can know what is going on. You can see these levels slowly rising. The doctor can start doing whatever they need to do in the body based on the progression of the various tests that you may be doing. Another thing to mention is your antibodies and your antigens. Now, your antibodies, your body produces antibody against bacteria, against viruses, against anything that is strange in your body. Your body produces antibodies to fight against any foreign matter that comes in your body. Now, the antigen, that is considered the foreign matter, right? So the antigen is the foreign matter that's in your body. The antibodies are what the body naturally produces from your white blood cells, from your bone marrow, to fight against these foreign matters. So many times, let's say I was given a rubella vaccine. I was vaccinated with rubella vaccine as a child. Now, for the rest of my life, when you check my levels, I will always come up positive for rubella antibodies, because in the process of vaccinating someone, you're exposing the person to the antigen, to a weaker dose of the bad guy, right? A weaker dose of the bad guy, of whatever the virus is, or whatever the virus is. You're getting a weaker dose of it. So your body sees it and say, hey, let's produce antibodies. These antibodies, for example, rubella and many others, stays in your system until forever, pretty much. So you will always test positive for rubella, for example, if your body has produced antibodies to it. However, if you find that you have antigens, like the COVID antigen in your system or some other virus in your system, the antigen, it means that chances are you probably have a current infection that you need to work on. You have your IgG, you have your IgM, but what you should understand is that some things may stay in your body. The antibodies will remain for the most part, while you get rid of the virus, the antigens that will go, but the antibodies may remain. So sometimes you get a result and you start to panic and you say, what is this? What is this? This says positive, this number is big. it's best to seek professional help to interpret the results along with your history, along with your family history. All of that combined will say, okay, this is normal or this is abnormal. I should worry. Well, either way, you should not worry because we believe in God, right? So we can pray and ask God for deliverance. And we give God thanks for his presence with us. So many times we even have persons on the Zoom who might have received some kind of abnormal results. And then you may have to go through surgery. You may have to go through various treatments. You may have to change your entire lifestyle. But we give God thanks and praise for wisdom and knowledge that he has given to medical personnel, and also for his presence with us, reminding us that he will keep us through every storm. Right? Now, all right. Well, this now brings us to our question and answer section. I do not have my questions there, but I'll be asking you some questions. Feel free at this time to unmute. And if you know the answer to the question, it's not multiple choice. Sorry, I know you're accustomed to the multiple choice question. But question number 1. This one is going to be an easy one. Do we test urine in the laboratory? Yes or no?
Yes.
Yes. Yes.
We do. Excellent. Next question. Next question. Can someone explain to me what is a clean catch urine? You're told to collect some urine, but they say make it a clean catch. What does that mean?
The middle. Leave out the beginning.
Yes, the container has to be
I
clean.
heard the middle.
clean.
We just want the
have
middle.
Middle.
You have to
Right,
make sure
the
that you wipe
middle.
clean first,
Good.
and
And
you leave off the first and the last.
very good. And why would we need a clean catch at times, a clean catch urine at times? Why would we need a clean catch urine?
Eliminate bacteria.
To detect infection.
Very good. If we're checking for infection in the urine, if we're checking for bacteria in the urine, we don't want to contaminate it with other bacteria that was not in the urine initially. So we want to make sure that we have a very clean catch. Excellent. Now the laboratory is made up of several different departments. Tell me one department and what they test for.
Hematology for complete blood count.
Hematology, complete blood count. Very good. Anyone else? All right, we had one. Miss Sister
Pathology.
Claudine, you were saying something? Pathology? Someone said pathology?
Yeah, pathology. And I think that has to do with cancer.
Okay, pathology, right? Pathology. Pathology lab is actually the general name for everything, for the entire medical laboratory system. Is called pathology laboratory. Because pathology, path is disease, and ology, the study of diseases, using the lab to study diseases. Yes, but then yes, you have cytology.
Yes, cytology.
Cytology, right? To check the tissue, the cells for cancer. Very good, very, very good, brilliant. All right, so those were my questions for you. Do you
And
have
my
any
favorite-
questions for me?
My favorite section is microbe.
Ah,
Yeah,
checking the bacteria.
that's right.
Checking the bacteria. Excellent, excellent. All right, I
All right,
see.
I saw Karen hand up for questions.
Yes, go ahead.
Before she come with her question, you can take down your PowerPoint.
Stop sharing screen. Okay.
Yes, stop sharing, please. Yeah. I think that was an excellent presentation, commendable. And I would ask all of you that are there to open your mic and give her a round big round of applause. I can see that people were
Yeah, man. Blessing, Mr. Duncan.
Awesome
Blessings.
presentation.
Amen.
Good, very good.
A good presentation.
Yes.
I'm
I'm
just
not sure that
it wasn't.
not sure that everybody understand everything that was said, but the video, it is taped, so I'm going to encourage you to go on YouTube, watch it over, and make sure that you like, because the more likes we have is the more they keep it on it. But if we don't have the likes, then they won't be, and they'll take it off. So I'll go now to the question. Karen, you were the first.
I don't recall you mentioning forensics and what it is for. The forensics test.
All right, thank you very much. The reason I did not mention forensics is because forensics is not seen as directly a part of the pathology laboratory. All right, but however, forensics deal with, when we hear about DNA, we hear about paternity, we hear about CSI, we hear about all these work, we think about
government medicals and HSA medicals. We do a lot of them. Where they test for amphetamines.
That's the urine for drugs, Karen.
Right.
It comes under
That's what it is. Yeah.
Yeah.
So under forensic, you'll find that they do the urine drug screen, checking to see if there's any drugs in the urine, and that goes back to the whole detective aspect where, let's say somebody overdose, you need to find out what chemical the person consumed that caused that overdose. So they can check to see whatever body fluid, if there's an overdose of a chemical. So they can check urine to see if you too much ganja or cocaine, etc. From the paternity side, they can say who is the father of the child, who is the mother of the child, who the child is related to. So you can have, and then also you have even using checking the body, if the body of the deceased, processing, seeing, finding things and examining it, identifying what it is. All of this falls under the scope of forensics.
Okay, Claudine, hand is up now.
Yes, excellent presentation. I have two questions. Why is it that some of the specimens take so long? The results are so long, in coming, and you have to send some of the samples overseas. Why does that happen?
Very excellent question, Sister Claudine. Now, some tests are done in-house, and I'm talking about every single lab in the Caribbean, right? Some tests you do in-house, meaning you do them right in lab. So like the common tests that I mentioned, like your CBC, your complete blood count, your comprehensive metabolic panel, your lipid, maybe even your thyroid, etc. Labs have the capacity to do these tests. In-house, you normally would get them back the same day, or you get them back the next day. However, you have some tests that are not ordered frequently. So although that particular lab may offer the test, it's cost effective for them not to perform the test every day, but they may perform it once a week, or they may perform it twice a week, depending on the number of samples that they have. So that may be one of the reasons why you may not get back your results as quickly as possible. Another reason too is that many labs uses reference labs. And these reference labs are labs that offer a greater variety of tests. They offer the tests that are uncommon, the tests that we hardly order. They offer those tests. And also maybe because let's say Cayman Islands and Bahamas and Turks and Caicos, we have very small islands. So sometimes it's not cost effective to offer certain tests in the lab, because it's only ordered maybe 2, 3, 4 times for the week. So it doesn't make any sense to invest in that. However, they may package a sample, freeze it or keep it at room temperature or keep it refrigerated depending on the specifications. And they may send it overseas. They may send it to Miami. They may send it to California. And sending it may take at least 1 day. And then they take another day to set it up. And then it may take some more time to process and to get those results back to you. So that too may delay. Then you have some other tests, like in microbiology, you have, sometimes they check for fungus. And you have some fungi, plural, that are slow growing. Some may even take up to 3 months, believe it or not. So it takes time, sometimes, for these organisms to grow and for them to identify it and to give you back results. So there are many factors, Sister Claudine, that may cause this delay in you not getting back your results on time. Sometimes it's a workload of the lab as well. Some labs are extremely busy and they just don't give you back your results in time.
Thank you for that. And my second question is, when you go to do tests, for example, even the COVID test, is it on the get-go that you will determine if, or how can you determine if I've had this condition before? For example, you are been vaccinated against BCG. As you mentioned earlier, you might need to do IgG or IgM or something like that. So is it on the get-go that you will know that the person would have had this condition, or you have to do further subsequent tests, if you understand what I'm asking?
Right. You have specific tests. If you want to find out if somebody had a virus in the past, you have a specific test that you would order. If you want to find out if the person have a current infection, that too is a different test. And then you have some tests that will give you both the IgG and the IgM together, so you can know exactly what's going on. So it would not be one test that covers everything. You would have to, let's say you go and do a COVID test and it says positive. Then you want to find out, is this an old infection? Well, no, if it says positive, it means that you currently have COVID, right? But some persons may want to break it down, find out if they had COVID in the past or if they're just getting COVID. And you can do further tests to break that down. For example, let's take maybe herpes, for example, or hepatitis B. Right, if you do a Hep B IgG, that will tell you, yes, this is a current infection. If you do a Hep B IgM, this is saying, oh, this is an old infection, or maybe this person was probably vaccinated at some point in their life. So depending on what you want, you have to order the specific test. And the lab is like a computer, garbage in, garbage out. So if you want a particular result and you order the wrong test, you're going to get the wrong results. If you want a particular result and you send the wrong test, you're going to get the wrong results, right? So you have to know what test you're doing, and then that's where the doctor comes in. The doctor can say, okay, this is what you want to know. This is how you can get that result. This is what you need to order to get that result.
Excellent. Thank you, madam. Thank you so much.
Okay, so next we have Sister Millicent Allen, followed by Selvin Bailey. But I just want to say that the body is such an interesting thing. I am really fascinated when it comes on to these IgG. So I can't remember. So sometimes when I get some results, when I was working, the IgG, I use a mnemonic, IgG to go, the G to go. That means it's past infection, IgM at present, in order to remember it. But for the most time, if I get something that is positive, like a hepatitis B result, I have to go to the doctor. Or HIV result, I have to go to the doctor to interpret it for me, because I keep on forgetting. But it's very fascinating, a very fascinating specialty. And I like when you plate those thing for antibiotic resistance. Yeah, I like that one. Not a nice place to be smelling, but I like that one. Yeah. All right, Sister Millicent, your question, please.
Thank you, Sister Duncan. Very good presentation. My question is, there are times samples that are sent to the lab, they come back invalid and they need to be repeated. What are some of the things that do happen for this to occur?
Excellent
What are the possible causes?
Excellent question. And I do understand too the frustration sometimes, because many times we don't like to have our blood drawn, you know, it's uncomfortable. And then to be told you have to have it drawn again. What are the causes? And not just blood, even sometimes other body fluids. What are the causes? So let's start with blood. Sometimes we have what we call hemolysis. Some tests, let's say your chemistry test, you need serum. They collect the blood, but they do not use the whole blood with all the cells. They spin it down, they centrifuge it, and it breaks it down. So first at the top, you'll have your serum, a yellow, clear yellow fluid at the top. Then just below it, we have what we call the buffy coat, which is the platelets that I mentioned. Platelets, white blood cells right there, a little white cloudy area. And then beneath that, you have a pack of red cells. So all the red cells, because they are heavier, when you centrifuge blood in the tube, the red cell falls to the bottom. Buffy coat, platelets in the middle, and then you have this nice serum at the top, yellow serum. Now, if after we centrifuge yellow part, if the serum comes up red, that's a problem. That's a problem. That's what we call hemolysis. It means that the red blood cells have lysed, or they have opened up and released the substance that's inside of them into the liquid part of the blood, into the serum. So the serum, which should be nice, it should be nice and yellow. When it's centrifuged, turns red, like red juice, right? So they may tell you to come back to have that redrawn, because certain tests cannot be done using a hemolyzed sample, because you have the substance out of the red cell goes into the serum and contaminates the serum, like your bilirubin. Your bilirubin will come back to you very high, and you're wondering what is going on. So if the sample is hemolyzed, that's one reason why they may call you and say, I'm sorry, you have to redraw the blood. And then hemolysis may take place as a result of the phlebotomy procedure. It may not be a proper phlebotomy procedure. It may be a difficult stick. These things can cause hemolysis to take place, and they'll call you to come back in. They may also call you to repeat a urine culture. We mentioned that the urine, we need a clean catch for urine cultures. If it wasn't a clean catch or it wasn't done properly, they may be finding 3 or more different types of organisms in the urine. They say, we need a new sample. They may call you back for that. Also, you may have a lab accident. At the end of the day, we're all human beings. Something might happen in the lab and they have to own up to it and say, I'm sorry, but we will need another sample because there was an accident, something might have broken. Another thing too, it might be quantity not sufficient. They took the blood, they ran the test, they got a result, but they need to do it again to recheck the results. And when they go back, they realize, oops, we don't have enough sample. We have to call back this patient. We cannot release this result unless we repeat it. Usually we repeat levels that are critically high or levels that are critically low. We repeat it to make sure that we get back that same result on the second run. But sometimes that may happen and they may call you back in to repeat your sample. And if that happens to any one of us in the future, don't worry, know the lab has our best interest at heart. And if they call you back for a sample, it means that they really need it in order to release correct, accurate, efficient, precise results. All right, Ms. Millicent, hope that answers your question.
Thank you. Yes, it does.
Okay. See Mr. Bailey, Alvin Bailey. Can go ahead.
I
can
Sister Soshara.
Yes, my brother.
Can you hear? Yes,
You're
thanks.
breaking up.
Thanks for a very informative presentation. I have a little question. I'm not sure if it is strictly down your street, but maybe you could maybe enlighten me a little bit. From a layman's standpoint, our understanding of a vaccine is that it is when the person is exposed to a controlled percentage of the virus and it creates an immunity, right? That's our understanding of the vaccine. Now, currently, a lot of persons who were vaccinated, right, they are realizing that they are coming down with COVID.
A lot of people who are vaccinated with what?
Who are vaccinated, they are the ones who are coming down with COVID.
Vaccinated with which vaccine?
With the COVID vaccine.
Okay, okay.
Yeah. They are coming down with the COVID. And people who are not vaccinated are not having that experience. So the question is, persons are being suspect of the COVID vaccine, and do you not think that this suspicion is warranted?
That's a very good question, Mr. Selvin. So your question is, do we have enough evidence to suspect that there's something going on with the COVID vaccine? Is that the question?
Yes, because if persons are vaccinated, right, with first, second dose and booster, and yet they're still coming down with the COVID virus.
Well, we do know that they have various strains of the COVID virus. As a matter of fact, we have thousands various different strains. So you will be told that whatever you were vaccinated with, whenever you got that vaccination, by today, the strain that is circulating is a different strain. So whatever you got, if you got vaccinated, it doesn't mean that you will not catch COVID in the future. We also find a lot of things since 2020 until now. We hear, even in the medical field, we've never seen so many persons coming down with various cancers, prostate cancer, breast cancer, all these things in the past 3 to 4 years. And a lot of things have been going on, and we do hope that we have the relevant research done at some point, Brother Selvin, for us to really narrow down and target what is going on, so we know clearly what to avoid and what to welcome.
Okay, Sister Sasha, thank you very much. Reasonable answer.
You're welcome.
Yes, sir. Yeah, just to know that virus mutate. And today you have one, and tomorrow they are very sensible, more than the human being. So they just mutate. Every day is a different mutation. We can't even keep up with them. They're smarter than us. Someone was asking about if there was what about eating how to dip out. Okay. What about eating and drinking before various lab tests? I know you mentioned the fasting.
Yes,
fasting.
What is it?
Yeah,
yes.
What is it? And I know for some, okay, that's not a lab test. I know for some tests, like you're doing some ultrasound or something, and you're on metformin, and so you have to discontinue it for a couple of days. But that would be Rosemary's specialty right there. So yeah. So
right.
Fast.
Right.
But is there any other test that you need to fast for besides the glucose and the
cholesterol,
triglycerides?
Right. Those are the more common ones that you'll be told to fast for, but we do have some others which are probably less common that it should be done on an empty stomach. As a matter of fact, we also have other tests that should be done like in the morning. right? Like cortisol, for example, they want an AM sample or a PM sample, or when we collect the blood, we have to tell what time of day it was collected. And based on the time of day, the levels in your body would vary. So we would know which normal range to use based on the time of day the sample is collected. But you do have other tests that require the body to be in a fasting state. As a matter of fact, you have some people who will come and say, whenever I'm doing a blood test, I normally fast. And that's a safe way, a very safe way to do it. That way you will be safe, because there's no blood test that they will say, if you fast for it, you know, something's going to be wrong. Once you're fasting within the 8 to 12 hours, but you do have other, but the reverse is true. You have blood tests where you must fast. So you have some persons, you tell the older person, they'll say, whenever I'm told to do a blood test, I always fast, and nothing is wrong with that. On a side note, eating, drinking. When it comes to fasting, some persons will fast and not drink any water at all. You can drink water, pure, unadulterated water, not vitamin water or, you know, the colored water,
lemon water.
Or lemon water. No, just you can drink pure water. And as it relates to taking your medication, check with your doctor, because if you're doing certain tests and you're taking medication to lower that same test, it will affect the results. So based on whether or not to take your medication while fasting, you can check with your doctor to see if you can or can't. But we encourage you to drink water, but do not eat anything. And also that includes gum, sweets, candy, things like that. You must be in a completely fasting state. No food, no juice to the body apart from water.
Excellent. Excellent.
Another thing too, I just want to mention briefly about Dr. Google.
Yeah.
Many persons, you know, instead of going to a physical doctor, they will check Dr. Google. I have this pain in my back, my foot, what do I need to do? And Dr. Google tells you to do this test and do that test. And then you try to go directly to the lab to do a particular test. And then the lab will tell you, hey, you can't get this done without a doctor's requisition. Right? So we encourage you, see the doctor. The doctor orders a test based on his findings or her findings based on questions asked. And then when the results come back, you may also need a doctor to interpret those results. So it's best to consult your physician.
All right. Yeah. Any more questions? I think
and just one last thing. One last thing on the vitamin D, for all as in duck or diamond. If you have not had your vitamin D test done recently, get your vitamin D test done. And if it's low, try to do what you need to do to increase your vitamin D. And once your vitamin D increases, it improves your overall health. Over to you, Nurse Fletcher.
Okay. I will again say that we had a very interesting presentation this afternoon. Very commendable, Sister Joy. I'm calling you Joy now, Sister Joy. And you know, I encourage you all to go back and watch the video. Somebody was asking how they're going to, how will they? I can't tell about YouTube. I just ask Mr. John to send me it, and I send it. So what I do, I send it to the Health Ministry Director for your conference. And you, the conference Health Ministry Director, should send it out to their Health Ministry's directors. They should have some group that they send information to. So please, as soon as I get it, I'm going to send it to all the Health Ministry directors, and please share it with your members. And it don't necessarily have to be a person who attend. I think it's something that everybody could listen and benefit from. Yes. So we have 3 presentations leave. Next one, we will have obesity. Then we'll have herbs, right? And then we'll have close out with hydrotherapy. After that, we'll give you 2 weeks to look on your presentations, and you're going to be doing a test. And at the end of the test, you need to do the evaluation of the program. So just remember that I'll put the names aside and the topics that the persons present, so you can tick what was interesting, what you didn't need to, you didn't like, and how we can improve the program and things like that. So I'm depending on you to help us evaluate the program so we can know how we can serve you better. And for those of us that are here and we are mothers, I'm starting to say happy Mother's Day. Next week, Sunday will be Mother's Day, and we changed so that everybody could spend time as being mothers, go do something, do a massage or whatever you feel like doing. Okay, so with that, there be no more questions. Everybody filled and overflowing. Going once?
Yes, it's a blessing, man. It's a blessing.
All right. And I do hope that, and remember now, I know we're having all kind of conflict. And for you health ministers director, I am just going to encourage you. If you must cancel all of your program to accommodate everybody's program, then nothing will be done. Even this evening, I was being asked to cancel this program because there were so many things going on. I don't see why. We cannot cancel all of our program. Everything we have, there will always be somebody, and people have choices what they want to do. I am asking you, please, as Sister McCartney, get ready to take some pictures. Please can open your camera. Please put your proper name on. Some of you don't have your camera on, and you don't have a proper name, so I can't. I think last week I had 3 names there that I didn't identify because they just have a name that I don't know where to find them.
You know my one.
Yeah, I know you're Andrew, but what if there was 3 Andrew?
No,
like what if we have sometimes we have like a 3 Karen. We have
is one original kid, and that's me.
No, you don't have kid, you have Andrew. All right. So please open your camera. Please open your camera right now before we get the closing prayer, so that Sister McCartney can do some picture for us, because I'm using the names to send out the presentation and the report. I don't want to be wasting time sending things to people that they're not interested and not here. So if you are not here, I'm not going to send you the presentation, and I'm not going to send you an update. So turn on your camera so we can see your face and put your proper name. If you are unable to turn on your camera, because some people don't know to do it, some people don't. Camera not working. Please turn on your camera. And we're going to get some pictures.